Welcome back. A first-of-its-kind mental health bill is one step closer to landing on President Joe Biden's desk. The House of Representatives passed the Dr. Lorna Breen Act, which would help doctors, nurses, and aides. It's named after a physician from Charlottesville. NBC29's Isabel Cleary is live at UVA Medical Center tonight to explain what's next for this bill. Hi, Isabel.
Hey, Casey. Dr. Lorna Breen was a graduate of UVA School of Medicine. She died by suicide while fighting COVID on the front lines last year. The Breen Act works to help keep healthcare workers safe.
Prior to the pandemic, the healthcare workforce was significantly burnt out. And in fact, going into the pandemic, people across the industry were talking about healthcare burnout as the #1 issue for the year.
Corey Feist is Dr. Lorna Breen's brother-in-law. He's been working to get this bill passed for the last year and a half. He says the trauma and depression associated with the healthcare field, even before the pandemic, created suicide rates twice the national average.
400 physicians every year died by suicide before the pandemic. Now that the pandemic has occurred, the burnout rates have amplified significantly across the industry.
The Lorna Breen Healthcare Provider Protection Act works to reverse these trends.
We have now sent the equivalent of a significant portion of our doctors and nurses across the healthcare industry off to war for over a year. And we need to support them as they come back from that war.
The bill would provide grants to reduce and prevent suicide and burnout and fund mental and behavioral health treatment. Representative Abigail Spanberger, who backed the bill, said in a statement, the act would not only get much needed help to our doctors, nurses, and healthcare professionals, but it would encourage them to seek support and treatment when they need it. Healthcare workers in current or past COVID hotspots would be the first to get the grants.
It's exactly what we've heard from the workforce every day, is that they're struggling and they need help. They need to be heard and they need to be taken care of. They've done such an amazing job taking care of all of us. This is just one small recognition that we can make to support them.
Now, this bill did pass in the Senate in the fall, but because of a small change, it now has to go back to the Senate for reapproval. If the bill is approved, it will go to President Biden's desk to be signed. Live at UVA Medical Center, Isabel Cleary, NBC29 News at 5.